Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we're diving into a health issue that affects more than 1 billion people worldwide: hypertension, also known as high blood pressure. It's a leading cause of heart disease, strokes, and even kidney failure. We'll be exploring the latest research on hypertension and some of the natural ways to manage it. Alex, there's a lot to unpack here. Ready to get started?
Absolutely, Emma. Hypertension is often called the silent killer because it can go unnoticed for years, quietly damaging the body. But there's a lot we can do to prevent and manage it. From understanding the effects of high salt intake to exploring herbal remedies, today we'll take a deep dive into how people can control hypertension and improve their overall health.
Let's start with something that seems simple but plays a huge role in hypertension: salt. Studies have shown that too much salt in the diet is a major contributor to high blood pressure, and recent research has taken this understanding to a new level. Alex, can you explain the impact of salt on hypertension?
Sure, Emma. It turns out that a high-salt diet doesn't just increase blood pressure. It can also set off a chain reaction in the body that makes it more vulnerable to hypertension-related damage. A recent study found that short-term high-salt intake can lead to inflammation in the blood vessels, which weakens them. In people with other risk factors, like those with a predisposition to hypertension or high levels of angiotensin II, a hormone that regulates blood pressure, this salt-induced inflammation can lead to severe conditions like aortic aneurysms and even increase the chances of heart attacks.
That's fascinating, and it really underscores the importance of watching our salt intake. But what's going on inside the body that makes salt so dangerous when it comes to hypertension?
It's a complex process, but basically high salt levels can activate certain immune cells in our blood vessels, specifically T cells, which then contribute to inflammation. This inflammation causes structural changes in the blood vessels, making them less elastic. When blood vessels can't stretch properly, blood pressure increases, putting more strain on the heart. Over time, this strain can lead to more serious complications like arterial damage or heart failure.
So the damage isn't just immediate. High salt intake can have long-term consequences that people may not even be aware of. It's scary to think how something as simple as our salt consumption can have such a profound impact on our health. And when you combine that with untreated hypertension, the damage to other organs can be severe.
Exactly, Emma. When high blood pressure goes unchecked, it starts to damage major organs like the heart, kidneys, and even the brain. In fact, a comprehensive study of over 8,000 people found that high blood pressure is closely linked to damage in various organs. For instance, it can cause the walls of the heart to thicken, a condition called left ventricular hypertrophy. This makes it harder for the heart to pump blood, leading to heart failure over time.
And it's not just the heart that's affected, right? Hypertension can also lead to kidney disease and increase the risk of strokes.
Absolutely. The kidneys are particularly vulnerable because high blood pressure damages the small blood vessels that filter waste from the blood. Over time, this can lead to kidney failure. And in the brain, hypertension can cause blood vessels to weaken, increasing the risk of strokes. That's why it's so critical to manage blood pressure before this kind of damage occurs.
So the stakes are incredibly high. And what's alarming is that hypertension isn't just an adult issue. It's becoming more common in children as well. Let's talk about that.
Yes, pediatric hypertension is something that's gaining more attention, but it's still underdiagnosed, especially in disadvantaged communities. A recent study implemented a program to improve blood pressure recognition in children, and the results were eye-opening. Healthcare providers were retrained and given better tools to identify hypertension in young patients. As a result, recognition rates increased by 58% in children and 43% in adolescents.
That's a huge improvement. It's critical to catch hypertension early, even in kids, because it's a strong predictor of future cardiovascular problems. I imagine these early interventions could prevent a lifetime of health issues.
Definitely. And what's interesting is that pediatric hypertension often goes unnoticed because children are rarely checked for it unless they have other health problems. This study highlights the importance of regular blood pressure monitoring in kids, just like we do for adults.
So it's clear that both children and adults need to take hypertension seriously. And while lifestyle changes like reducing salt intake are important, there's also growing interest in herbal remedies that can help manage blood pressure naturally.
I'm glad you mentioned that, Emma, because there's a lot of promising research on how herbal products can complement traditional antihypertensive therapies. Herbs like garlic, green tea, and berberine have been shown to lower blood pressure and protect the heart. Let's start with garlic. It's one of the most well-researched herbs for heart health. Garlic contains a compound called allicin, which helps relax blood vessels and improve blood flow, ultimately reducing blood pressure.
I love that something as simple as garlic can have such a powerful effect on our health. And what about green tea? I know it's often praised for its antioxidant properties.
Yes, green tea is packed with catechins, especially epigallocatechin gallate, which helps reduce inflammation in the blood vessels and improve endothelial function. This not only lowers blood pressure but also supports overall heart health. And then there's berberine, which is found in herbs like golden seal and barberry. Berberine helps lower blood pressure and cholesterol levels, making it an excellent choice for people with metabolic syndrome.
It's amazing how these natural remedies can work alongside conventional treatments. But I know there's something we need to keep in mind. Herbs can interact with medications. Let's talk about that next.
That's right, Emma. Some herbs can affect how the body processes certain medications. For example, green tea can reduce the effectiveness of blood pressure medications like lisinopril, while garlic can increase the bioavailability of other drugs like nifedipine. This means that herbal remedies can sometimes make medications more or less effective, so it's important to talk to a healthcare provider before adding any herbs to your routine.
Definitely something to keep in mind. Now let's take a closer look at some of the specific herbal products that can help manage hypertension.
We've already talked about garlic, green tea, and berberine, but there are other herbs that can also help. For instance, celery acts as a natural diuretic, helping to reduce fluid retention and lower blood pressure, particularly in people who are sensitive to salt. Then we have ginkgo biloba, which improves circulation but needs to be used with caution because it can interact with some blood pressure medications.
I've heard a lot about ginger too. It promotes vasodilation, helping to improve blood flow and lower blood pressure naturally. It seems like these herbs offer a holistic way to manage hypertension.
They really do, but it's important to use them carefully, especially if you're taking medications. And speaking of holistic approaches, there's a specific herbal formula from the Lost Book of Herbal Remedies that combines several of these powerful herbs.
This formula brings together garlic, green tea, berberine, and other herbs like Nigella sativa, also known as black seed, which has anti-inflammatory properties and works well with blood pressure medications. Celery, ginger, and cinnamon are also part of the formula, each contributing to improved heart health and reduced blood pressure.
It's a comprehensive approach to managing hypertension. The formula not only helps lower blood pressure, but also addresses the underlying inflammation and metabolic issues that often accompany hypertension. It's important, though, to remember that you should always consult with a healthcare provider before starting any new herbal treatments, especially if you're on medication.
Absolutely. Now, to sum up everything we've covered today, hypertension is a serious condition that requires a multifactorial approach, from reducing salt intake to using herbal remedies. By understanding the risk factors and taking proactive steps, people can effectively manage their blood pressure and improve their overall health.
That's right, Emma. We've looked at the impact of high salt intake, the damage hypertension can do to your organs, the growing problem of pediatric hypertension, and the powerful role herbal remedies can play in managing this condition.
Thanks for joining us today. For more details on everything we've discussed, head over to Herbal Bloom. Remember, with the right knowledge and tools, you can take control of your health.
It's clear that a combination of diet, lifestyle changes, and natural therapies can make a real difference in managing high blood pressure. Until next time, stay informed and stay healthy.
Take care, everyone.